Ever wonder if something as simple as your bedtime routine could quietly be putting your life at risk? Each year, more than 70,000 older adults pass away in their sleep in the US, and it's not just due to aging. The truth. Seemingly harmless. Nighttime habits might be the silent danger nobody warned you about. Until now. Have you ever stopped to consider that the very things you do before bed, those tiny routines that feel so ordinary, might actually be endangering your health? It sounds unbelievable, but according to the Centers for Disease Control and Prevention, over 70,000 seniors die in their sleep every single year in the United States. And here's the shocking part. Many of these deaths aren't just the result of aging. They're linked to overlooked, preventable nighttime habits that most people never even question. Once you cross the age of 60, your body begins to change in quiet but significant ways. Your heart becomes more delicate, your lungs more reactive, your brain more sensitive to interruptions, sleep gets lighter, muscles become weaker, and what used to be harmless like a late-night snack, a glass of tea, or staying up a little too late can suddenly have a very different, very dangerous effect. But here's the kicker. Most older adults continue following the same routines they've had for years, not realizing that these familiar bedtime habits might actually be harming their long-term health and safety. So what exactly are these hidden threats? Which common bedtime mistake is responsible for more late-night emergencies than any other? And more importantly, what can you do tonight to start making your sleep safer and healthier? In this video, we're going to uncover 7 dangerous nighttime habits that have already cost the lives of countless seniors this year alone. And let me tell you now, habit number 2 might be the most unexpectedly deadly, but don't panic. Along with identifying these risks, I'll also share practical, easy-to-follow tips you can start using tonight to protect yourself or your loved ones. If this is your first time here, welcome to Senior Health Boost, where we help you grow stronger, wiser, and healthier one smart choice at a time. If you find this helpful, don't forget to like this video and subscribe to Senior Health Boost so you never miss the next life-changing tip. And tell us in the comments, where are you watching from? We love seeing how far our health-conscious community stretches around the globe. Alright, let's dive in, starting with habit number 7, drinking too much water before bed. Now, staying hydrated is essential, especially for older adults. Water plays a crucial role in nearly every function of the body, supporting digestion, protecting joints, maintaining circulation, and even boosting mental clarity. But timing is everything. Drinking large amounts of water, or even herbal tea or juice right before bed can be more harmful than helpful, especially after 60. Why? Because as we age, our kidneys process fluids more slowly, and the bladder holds less than it used to. On top of that, the urge to urinate becomes more frequent and much more urgent. So, if you're hydrating heavily an hour or 2 before sleep, chances are your rest is going to be interrupted. Once, twice, maybe more. Waking up at night may seem harmless, but for seniors, it's a real danger. Imagine a 2 or half asleep, the room is dark, and your balance isn't what it used to be. You stand up too fast, your blood pressure drops, and suddenly, a simple bathroom trip turns into a serious fall. Falls are no joke. In fact, the CDC confirms that falls are the leading reason older adults are hospitalized, and many of those falls happen during nighttime bathroom runs. But there's another layer to this issue: poor sleep. Repeatedly waking up through the night can disrupt your deepest stages of sleep, the ones responsible for healing and memory. Without this quality rest, the brain and body suffer. Chronic sleep interruptions have been directly linked to memory decline, increased inflammation, and a higher risk of dementia and Alzheimer's disease. Not to mention, poor sleep can make existing health conditions like diabetes and high blood pressure even worse. And here's something many don't realize. Drinking too much liquid at night can also strain the heart. For seniors already dealing with cardiovascular issues, this added fluid volume may push the heart into overdrive, triggering irregular rhythms or dangerous stress on the circulatory system. So how can you hydrate smartly without sacrificing your sleep or safety? It all comes down to balance and timing. Make sure you're drinking plenty of water earlier in the day, in the morning and early afternoon, then start scaling back in the evening. As a general rule, try to avoid heavy fluid intake at least 2 hours before you head to bed. If you get thirsty closer to bedtime, just take a few small sips instead of a full glass. And it's not just about water. Be cautious with caffeine and diuretics like black tea, coffee, or citrus juices in the late afternoon or evening. They'll only increase the chances you'll need to get up at night. If nighttime bathroom visits are unavoidable, take precautions. Keep a clear, well-lit path between your bed and the bathroom. Use soft nightlights or motion sensor lamps. Remove any rugs or clutter that could become tripping hazards. Safety starts with awareness, and a little planning goes a long way. Now that you know how something as simple as drinking too much water at night can quietly put your safety at risk, let's look at another seemingly harmless bedtime habit, one that could be sitting right on your dinner plate. Habit number 6, eating late at night. We've all been there. It's the end of a long, tiring day, and a small treat before bed feels like a well-earned comfort. Maybe it's a warm bowl of soup, a leftover slice of pie, or a handful of crackers while watching TV. But what if that innocent snack is doing more harm than good, especially after the age of 60? For older adults, late-night eating doesn't just bring a risk of indigestion, it triggers a series of internal stress responses that your body becomes less equipped to handle with age. That midnight bite might be keeping your organs awake when they should be resting. You see, as we age, our metabolism naturally slows down. Our digestive system becomes less efficient, and regulating blood sugar and cholesterol becomes more difficult. A heavy meal late in the evening forces your body to stay active when it should be winding down. Instead of focusing on repair and recovery during the night, your system is working overtime to process that food. The result: poorer sleep, strained digestion, and overworked organs like the heart, liver, and pancreas at the very moment they should be resting and restoring. The biggest issue: acid reflux. When you lie down soon after eating, gravity is no longer helping to keep stomach acid in place. That acid can creep upward into the esophagus, causing that painful burning feeling in your chest, known as heartburn or acid reflux. While it's uncomfortable at any age, for seniors, it's a serious concern. Chronic acid reflux can cause inflammation in the esophagus, damage delicate tissues, and, in some cases, lead to aspiration pneumonia, condition where stomach contents accidentally enter the lungs during sleep. It's more common than you think, and it can be life-threatening. In fact, a study published in the American Journal of Gastroenterology revealed that people who eat within 3 hours of bedtime are significantly more likely to suffer from reflux episodes and associated complications during the night. And if that late-night snack includes sugar or refined carbs like cookies, white bread, or sweet drinks, it could also disrupt your blood sugar balance. As we age, our cells become less sensitive to insulin, the hormone responsible for helping manage blood sugar levels. This makes older adults more vulnerable to spikes in glucose, which can either lead to type 2 diabetes or worsen it for those who already have it. A 2020 study in the Journal of Clinical Endocrinology and Metabolism found that eating meals late at night is linked to higher blood sugar and insulin levels the following morning, especially in older individuals. These spikes don't just mess with your metabolism, they can damage blood vessels, increase inflammation, and contribute to long-term complications like neuropathy or kidney disease. But we're not done yet. Eating late doesn't just upset your stomach or sugar balance, it also affects your heart. Typically, blood pressure drops at night to give the heart a chance to rest. But when you eat something heavy, fatty, or salty late in the evening, your body stays in digest mode, keeping your blood pressure elevated. This can prevent your cardiovascular system from relaxing, and may even increase your risk of heart attack or stroke while you sleep. Some cases, large or heavy evening meals have been shown to trigger irregular heart rhythms, particularly in people with existing heart disease. Imagine your heart working overtime to process that meal, just when it should be slowing down. So, what's the solution? It starts with timing. Make it a habit to finish your last full meal at least 3 hours before bedtime. This gives your digestive system time to do its job before your body transitions into rest mode. Choose lighter, balanced dinners that are easy to digest. Think lean proteins like chicken or tofu, steamed vegetables, and whole grains like brown rice or quinoa. Avoid greasy foods, fried dishes, processed snacks, or rich desserts before bed. These not only take longer to digest but also cause bigger spikes in blood sugar and blood pressure. If you find yourself truly hungry before sleep, don't starve. Just choose a small, gentle snack. Good options include half a banana, rich in magnesium and easy to digest. A spoonful of plain yogurt helps your gut and has tryptophan to aid sleep. A few unsalted almonds or walnuts providing protein and healthy fats without spiking sugar. These choices are less likely to disturb your sleep and won't place a heavy load on your system at night. By making just a few thoughtful adjustments to your evening routine, you'll not only sleep more soundly but also reduce your risk of serious health problems like acid reflux, high blood sugar, cardiovascular stress, and nighttime emergencies. When your body isn't weighed down by late digestion, it can focus on the real job of the night: healing, rebuilding, and preparing you for a stronger tomorrow. Habit number 5 now. Speaking of nighttime routines, there's something else that often goes unnoticed: your sleeping position. Most people have a favorite way to sleep: on their side, back, or curled up in a certain way. But did you know that the way you position your body at night can have a powerful impact on your heart, lungs, and even brain? In fact, one common sleeping posture could be quietly robbing your body of oxygen every single night. Let's take a closer look in the next section. Habit number 5. Sleeping in the wrong position. Most of us have a favorite way to sleep. Maybe you curl up on your side, sprawl out on your back, or shift around through the night. But as we age, our sleep posture becomes more than just a matter of comfort. It can directly impact our breathing, heart health, and even cognitive function. Let's start with one of the most problematic sleep positions for seniors: sleeping flat on your back. Also known as the supine position. While lying on your back may feel restful, it can quietly worsen several health issues. For individuals dealing with acid reflux or a hiatal hernia, this position makes it easier for stomach acid to creep upward into the esophagus. And that's not always something you feel. Silent reflux during sleep can go unnoticed, slowly irritating the throat lining and increasing the risk of aspiration pneumonia, a serious condition where acid or food particles accidentally enter the lungs. Even more concerning, repeated exposure to acid can cause long-term damage that, over time, raises the chance of developing esophageal cancer. But that's just the beginning. Your sleeping posture also affects how your brain detoxifies itself. A groundbreaking study from Stony Brook University found that sleeping on your back reduces the brain's natural waste-clearing system called the glymphatic system by more than 60%. This system plays a crucial role in flushing out toxic proteins, including the beta-amyloid and tau proteins linked to Alzheimer's disease and dementia. In short, your brain needs your body to be in the right position to clean itself efficiently. If not, toxins build up faster, and the risk of cognitive decline increases dramatically with age. But even sleeping on your right side can have drawbacks, especially for seniors with heart conditions. It may compress major blood vessels near the heart, interfering with circulation. Over time, this could put extra stress on an already vulnerable cardiovascular system and raise the risk of heart failure. So, what's the safest sleeping position? For older adults, according to sleep experts, the clear winner is the left side. Sleeping on your left supports better circulation, enhances digestion, and reduces the risk of acid reflux, stroke, and irregular heartbeat. It also allows your brain to clear waste more effectively during deep sleep, helping protect memory, focus, and long-term brain health. But let's be honest, switching sleep positions isn't easy, especially if you've been sleeping a certain way for years. The good news is, there are practical tricks to make the transition smoother. Here's what you can try. Use a firm pillow between your knees to keep your hips and spine aligned. Tuck a body pillow or rolled towel behind your back. To stop yourself from rolling onto your back during the night, support your neck with a contoured pillow to keep your head in line with your spine. Elevate the head of your bed slightly if you experience reflux. Just a few inches can make a world of difference. You might not adjust overnight, but over time, your body will adapt, and the health benefits are worth every bit of the effort. Better breathing, improved circulation, stronger brain detox, lower risk of nighttime emergencies. All from a simple shift in how you sleep. By making this one change, you give your body the opportunity to rest, repair, and reset every single night. Habit number 4. Now, even if you're sleeping in the perfect position, there's one more factor that could still be sabotaging your health at night: the temperature of your room. It's common to want a cozy, warm space as we age. But what if that warmth is quietly disrupting your sleep, your heart, and even your immune system? Let's uncover the hidden dangers of sleeping in a hot room coming up next. Now that we've tackled how your sleep position can affect your heart, lungs, and even brain health, it's time to look at something just as powerful but often overlooked: the temperature of your room. This brings us to habit number 4. Sleeping in a hot room. Habit number 4. Sleeping in a hot room. It's natural to want warmth and comfort at night, especially as we get older. Many people layer up with blankets, turn up the thermostat, or close every window to keep the night chill away. But here's the problem. A warm, cozy bedroom may be doing the exact opposite of what your body needs to sleep well and stay healthy. As we age, our internal temperature regulation weakens. That means the body struggles more to cool itself down, especially in a warm or stuffy room, and that cooling process is essential. In fact, your core body temperature naturally drops as you fall asleep. It's your brain's signal to enter the deep, healing phases of rest. But when the room is too warm, typically above 68 degrees Fahrenheit, 20 degrees Celsius, your body has to work harder to cool off. That effort keeps your system alert when it should be winding down. The result? Light, fragmented sleep, frequent waking, and a groggy, unrefreshed feeling in the morning. And the consequences don't stop there. A study published in the American Journal of Geriatric Psychiatry found that seniors sleeping in warmer environments get up to 30% less deep sleep, the kind needed for memory consolidation, immune support, and tissue repair. That means your brain and body aren't getting the recovery time they desperately need. Sleep disturbances linked to heat have also been connected to higher blood pressure, increased inflammation, and weaker immunity. Over time, these changes can raise your risk for serious health problems like heart disease, diabetes, and even early cognitive decline. But here's a danger that's even harder to notice: dehydration. Older adults often feel less thirsty than younger people. Combine that with warm bedrooms and night sweats, and you've got a perfect recipe for fluid loss without even realizing it. This dehydration can cause thicker blood, which increases the risk of blood clots, irregular heartbeat, or even stroke, especially in those with heart or lung conditions. So how can you cool things down the right way? Experts recommend keeping your bedroom temperature between Y-67 degrees Fahrenheit, P-19 degrees Celsius, This range supports the body's natural cooling process and encourages deeper, more restful sleep. You don't need to turn your bedroom into a refrigerator, just aim for a space that feels crisp and breathable, not stuffy. Here are a few simple steps. Choose light, breathable bedding, like cotton or bamboo sheets. Avoid heavy quilts or electric blankets that trap and retain too much heat. Use layered blankets that are easy to remove. During the night, if you feel warm, open a window slightly or run a quiet fan to increase airflow and reduce stagnant warmth. These small environmental tweaks can dramatically change your sleep quality, and the benefits are real. Lower heart stress, improved brain function, stronger immunity, and better overall energy during the day. Creating the ideal sleep environment doesn't require a complete bedroom makeover, just a few thoughtful changes that make a big difference over time. Habit number 3, but even if your room is cool and comfortable, there's another hidden risk many seniors face: how they get out of bed. Sounds simple, right? But rising too quickly can trigger something far more dangerous than you'd expect. Let's talk about habit number 3. Habit number 3. Getting out of bed too quickly. Have you ever woken up in the middle of the night, swung your legs over the edge of the bed and suddenly the room feels like it's spinning? You're not alone, and no, it's not just in your head. For older adults, getting out of bed too quickly can lead to a dramatic drop in blood pressure, a condition known as postural hypotension or orthostatic hypotension. This happens when your body doesn't adjust fast enough from lying down to standing up, causing blood to pool in the lower body and limiting blood flow to the brain. The result? You feel dizzy, lightheaded, or momentarily lose your vision. In some cases, it can even cause brief fainting. That split-second loss of control can lead to a serious fall-in for seniors. That's a major risk. Research published in JAMA Internal Medicine found that older adults with postural hypotension face a much higher risk of falls, fractures, and even death. Falls are already the leading cause of injury-related hospital visits among seniors, and many of those happen late at night or early in the morning, precisely when blood pressure tends to be lowest, and the body is still sluggish from rest, and the fallout from one bad fall can be devastating. Broken hips, head injuries, and fractured wrists are all common outcomes. Recovery can be long, painful, and in many cases, the beginning of permanent mobility loss or loss of independence. But the good news, preventing these falls is completely within your control and doesn't require anything extreme. Start with the simplest step: slow down. When you wake up, resist the urge to jump out of bed. Instead, 1. Sit upright and rest for a few moments. Point 2. Move your feet gently. Rotate your ankles or flex your legs to get your blood flowing. 3. Take slow, deep breaths and allow your system to adjust. If you tend to wake up dehydrated, keep a glass of water by your bedside and sip it slowly before standing. Hydration supports blood flow and helps minimize sudden drops in pressure. Your environment plays a critical role too. Here's how to make your surroundings safer. Use night lights or motion-activated lamps so you can see clearly when moving. Wear non-slip slippers instead of socks that can slide on hard floors. Clear clutter and loose rugs from walkways to eliminate tripping hazards. Use sturdy furniture like a dresser or bedpost for support when standing. If needed, install grab bars next to your bed or in the bathroom. Also, if you're taking medications like diuretics or beta blockers that affect blood pressure, speak with your doctor. They might recommend adjusting the timing or dosage to help prevent nighttime hypotension. It may seem small, but these changes are powerful. By simply slowing your movements and setting up your environment for safety, you can dramatically lower your risk of falls and maintain your independence and confidence. Remember, how you get out of bed matters. It's not just about feeling about protecting your brain, bones, and your freedom as you age. Habit number 2, gentle lead-in. Next up, there's one nighttime danger that often goes unnoticed, yet it can rob your heart of oxygen, damage your brain, and increase your risk of stroke. It starts with a sound most people ignore: snoring. Let's break it down in habit number 2. By now, we've seen how something as simple as how you get out of bed can make the difference between safety and a fall. But what if one of the most dangerous threats to your health is happening every night without you even knowing it? Let's talk about habit number 2, ignoring snoring, breathing pauses, or chronic insomnia. Habit number 2, ignoring snoring, breathing issues, and chronic insomnia. Snoring. It's often brushed off as an annoying habit, something that happens with age or weight gain. A partner complains, you laugh about it, and move on. But what if snoring, gasping, or repeatedly waking up during the night were actually signs of a silent, life-threatening condition? For millions of older adults, they are. Experts believe that nearly 40% of seniors suffer from some form of sleep apnea. Over 80% of cases are never diagnosed. Why? Because many people mistake the signs for normal aging. They assume that waking up tired, struggling with memory, or needing frequent naps are just part of getting older. But that's not necessarily true. Sleep apnea occurs when the muscles in your throat relax too much during sleep, causing your airway to narrow or close altogether. This leads to brief but repeated pauses in breathing, sometimes for just a few seconds, sometimes for much longer. It can happen dozens or even hundreds of times per night. Each time your breathing stops, your brain sounds the alarm, forcing your body to jolt awake, even if you don't realize it. This process causes oxygen levels to drop, heart rate to spike, and inflammation to rise. Over time, this constant strain can lead to high blood pressure, irregular heartbeat, increased risk of heart attack, greater chance of stroke, faster cognitive decline. In fact, the Sleep Heart Health study revealed that untreated sleep apnea increases the risk of fatal heart attacks by 30% and stroke by up to 60% in adults over 60. That's no small number. But the damage isn't just to your heart. Sleep apnea robs your brain of deep rest, the kind of sleep that restores memory, attention, and emotional health. Without it, seniors may start experiencing symptoms like memory lapses, mental fog, irritability, mood swings. Early signs of dementia. A growing body of research shows that untreated sleep apnea can lead to loss of brain tissue, especially in areas responsible for decision-making and memory, and it happens nearly 3 times faster than in normal aging. So how do you know if sleep apnea is affecting you or someone you love? Often, it's a spouse, family member, or caregiver who notices the signs first. Key red flags include loud, frequent snoring, gasping or choking sounds during sleep, long pauses in breathing, waking up multiple times a night, waking up with a dry mouth or headache, feeling groggy, even after a full night's rest, needing multiple naps during the day. Another signal, chronic insomnia. While an occasional sleepless night is common, ongoing issues, falling or staying asleep, may point to underlying health problems if paired with high stress, heart trouble, or hormonal imbalances, and the health impact is bigger than most realize. Insomnia has been linked to weakened immune system, poor blood sugar control, worsened high blood pressure, heightened anxiety, or depression. If any of this sounds familiar, don't wait. Talk to your doctor or a sleep specialist. Getting evaluated for sleep apnea is a simple, non-invasive process that can reveal the root of your sleep issues. Effective treatments include CPAP machines, which keep airways open during sleep, oral devices, custom fitted by a dentist, weight management and breathing exercises, lifestyle changes, such as adjusting your sleep position or cutting alcohol. Here's the good news. Addressing sleep apnea and insomnia can dramatically lower your risk of heart complications, stroke, and memory loss. One long-term study found that using a CPAP machine properly reduced heart-related risks by over 40% in seniors. So remember, snoring isn't just a noise, it's a signal. Don't ignore it. Treating it may be one of the best things you ever do for your heart, brain, and overall vitality. Habit number 1, taking certain medications before bed. Let's move on to our final and possibly most overlooked habit. Number 1, taking certain medications before bed. For many seniors, nighttime pills are part of a routine. A sleeping aid, something for joint pain, a blood pressure med. It's all so familiar. But when taken at the wrong time or in the wrong combination, these medications can pose serious risks, especially during the night. Let's start with sleeping. Pills and anti-anxiety medications such as diazepam, clonazepam, or alprazolam. These drugs, known as benzodiazepines, are prescribed to help calm the nervous system, but they also slow down breathing, reduce mental alertness, and interfere with the brain's natural sleep rhythms. That's especially dangerous for older adults with underlying heart or lung conditions. According to a major study in the British Medical Journal, seniors who regularly use these drugs have a significantly higher risk of falls, fractures, and even premature death compared to those who don't. And the effects can spill into the next day, causing grogginess, dizziness, and slower reflexes, which further increases the risk of slips, confusion, and even car accidents. But sleep medications aren't the only concern. Muscle relaxants and certain antidepressants can disrupt deep sleep, leaving your brain underrested and your body less able to repair itself overnight. Over time, this can lead to memory issues, mood changes, and worsened cognitive function. Then there are pain relievers, especially NSAIDs like ibuprofen or While effective at easing joint pain, using them frequently at night can put strain on the liver and kidneys, especially when combined with other medications. Some can also increase bleeding risk, particularly if you're already on blood thinners. What about blood pressure meds? Some patients are advised to take them at night. For others, this can lead to a dangerous drop in blood pressure during sleep, reducing blood flow to the brain and triggering dizziness or even fainting. A study published in Hypertension emphasized that timing matters, and the right schedule can vary from person to person. One more concern: drug interactions. As we age, our metabolism slows. This means drugs can stay in the body longer, increasing the chance of toxic buildup or unexpected side effects. Combining sedatives, painkillers, and heart medications without professional guidance can lead to confusion, fatigue, and sometimes life-threatening consequences. So what's the safest path forward? Here are a few essential steps. 1. Review all your medications prescribed or over-the-counter with your doctor or pharmacist regularly. 2. Ask if any of them should be taken in the morning instead of before bed. 3. Avoid sleep medications unless absolutely necessary. Try natural methods first. Chamomile tea, magnesium-rich snacks, light stretching, or guided breathing exercises. 4. Monitor your blood pressure at night if you're on hypertension medication, and report any dizziness or unusual symptoms. 5. Always read the labels and ask about interactions, especially when starting a new drug. Being intentional about your nighttime meds can protect your brain, organs, and mobility and help you wake up feeling clearer, steadier, and healthier each morning. So what have we learned? Even small nighttime habits like a late-night snack, a warm bedroom, or the position you sleep in can quietly shape your heart health, brain clarity, and overall longevity. You've now discovered the 7 hidden bedtime habits that can quietly harm your health after 60. But the most important part, you have the power to change them starting tonight. Whether it's adjusting how you take your medication, making your room cooler, or simply rising from bed more slowly, each small step adds up. Together, they create a safer, more restorative night's sleep so you can live longer, feel stronger, and age with confidence. Have you experienced one of these habits yourself? Or maybe you've already made a positive change that's helped you sleep better. We'd love to hear from you. Drop a comment below and share your story. Your experience might inspire someone else. And if you found this video helpful, please give it a thumbs up, subscribe to Senior Health Boost, and turn on notifications so you never miss another tip. We're here to help you take back control of your nights and your health. Thanks for watching, and until next time, sleep well, stay safe, and stay strong.